Did you know a quarter of all young people aged 15 to 25 use drugs in the last year? Each year, over 12,000 young people under 25 are admitted to hospital for substance abuse. 6% of all deaths among young people are drug-induced or related.
I started hitting ice a lot harder than what I was hitting before. The first time in April, I was really only using about $100 a night, which is about 0.1 gram, and now I've been using up to like 1 gram a day, so it's just been boosting up to like $800 a day, and then plus my other drugs that I was using and hitting prescription drugs harder, and just ended up in me resulting causing 50 grand of damage to my parents' house in ice rage, and it just ended up in me getting arrested and put in custody, and I've been really stuffing up my life, and I really regret what I've done, and I wish I could have gotten off drugs earlier.
Thankfully, Jamie found Triple Care Farm, a unique, award-winning rehabilitation program for young people. For over 20 years, Triple Care Farm has changed the lives of thousands of our most challenged young people with unparalleled success rates, helping young people to make real and sustained change in their lives. Young people wanting to escape the devastating cycle of substance abuse must first go through detoxification. This is a painful, frightening process that can lead to panic, rage, depression, and escape through increased drug use.
Withdrawals are really hard. You get hot and cold sweats, headaches, you physically feel sick, and also mentally you do feel drained.
So, how can young people detox?
So there's a number of different options available for a young person who's wanting to rid their body of substances through a withdrawal process. For some young people, they can talk to their GP. They can look at doing a home-based detox. But this has implicit in it that there's a safe place for them to be able to go while that process is happening. That's often Panadol, or perhaps a script for some Valium to help them through a detox process at home. There's very little support, and there's very little follow-up as to how that's actually gone with the young person.
It doesn't work. You really need to be taken out of the environment and away from the drugs. Being at home, you're still in the same environment, and it's really hard.
The second option is a hospital-based detox, where a young person's admitted to hospital for a period of time, but for most of those withdrawal options, it's in a general hospital bed. There are a few adult detoxification programs, but they are fairly similar to those home-based detox. They're just based at an adult service or an accommodation service.
I've done a detox before at Belmont, and I think it would have been different if I'd done it here, because there would have been activities to do instead of being stuck in a building all day, which makes most people bored and want to leave. When they leave, they relapse.
I went to detox, but I bailed because I found it hard and a bit scary. I was around some people that had chopped other people's heads off, had their mum stabbed to death in front of them, been raped as a child, just some real heavy stories that were just really not cool, and just people were squeezing alcohol wipes and drinking them while it was there, and it was just and punching walls and breaking hands, and it was just a really violent experience. It just didn't feel right doing NA meetings with them, just because they were so much further into their drug addiction than I was. I was only 16 at the time, and I didn't feel comfortable at any point I was there.
We're proposing to build a 10-bed, 28-day program residential withdrawal unit on site at Triple Care Farm. It will be a state-of-the-art facility with round-the-clock medical supervision and all the support services necessary to help young people effectively withdraw.
This youth withdrawal unit is a new and innovative program. There is nothing in Australia that looks anything like this, that actually looks at addressing issues for young people before they become chronic and lifelong.
If there was a detox here at Triple Care Farm, I reckon I would have coped a lot better. Just because of the environment that it is here. We're all kind of in the same boat, none of us have missing teeth and stuff like that, so I'd reckon I would have had a much more pleasant experience in detox, and I probably would have made it to Triple Care Farm the first time.
So why 28 days? The literature review says that it will take between 4 to 14 days for substances to be fully out of the body. But we're not just wanting to provide a medical withdrawal. We're not just wanting the substances to be out of the body. We also want to provide counselling, case management and a treatment intervention that at the end of that 28 days, a young person is ready to go back out into the community well underway with overcoming their substance use issue and getting life back on track.
We need your help to ensure that these young people get a second chance at life before it's too late.